So you ready, Mindy? Everybody
Yep,
ready?
ready.
Okay, great.
Yep.
So welcome everybody to the Tuesday, September 9th meeting of the Advisory Board of Health. Um, we only have two orders of business. The first is to approve the June minutes, which were distributed prior and have been on the town website in draft form. If there's any objections, we'll make those final. Is that okay with everybody? Okay. And the second order of business is Health Department update. So Mindy, take it away.
Okay. So I have a couple of pages. I'm gonna read these out to you of what's been going on here at the health department over the course of the last quarter since we met. As far as staff updates go, we still have an open part-time nurse position. We did offer it to somebody. It did not end up going through the process entirely, so we had to repost it. So we have 2 interviews scheduled for next week. And again, I'll just remind you that the department has been without a part-time public health nurse since February. So this is a long time. So it's a very high priority to get that position filled. Seasonal public health activities were a huge success. I'm very proud of this. That, although the summer is very fast paced and very time sensitive public health activities that we do here, we were able to open 16 pools successfully around Memorial Day. We also opened up seasonal food service establishments. Some are freestanding, like Weed Beach, for example, and then some are associated with some of the clubs and some of the pools that we permit and inspect every year. As far as beach water quality goes, we do weekly testing, as you know, from Memorial Day to Labor Day, and I'm proud to report there were no elevated bacteria levels this entire year. So that's 15 weeks of testing. The only time that we closed beaches was twice. And those are preemptive closures, again, just precautionary due to rainfall that exceeded 1 inch in 24 hours and just to align with safety protocols. And the minimum closure for those are 24 hours, and we were able to reopen the beaches. So, again, that only happened twice this summer. We also beta tested a new DPH website that provides real-time public notifications for closures and advisories. This is not has not been released yet to the public, although somebody savvy could do a search and find them. But what the idea behind DPH doing this is to connect all public water, beach water places. So instead of someone going to the town of Darien, they could go to this website. They would be able to see if Hammonasset's open, if Sherwood Island's open, if there's any closures, why things are closed. So that there's more to come on that. Again, we just beta tested it with all of our data points this year. Also, a new committee was established with the Connecticut Association of Directors of Health, and I am part of a subcommittee under the environmental health section that's talking about defining and reviewing water quality terminology. So, as a health director, I've always wondered why some places are issuing advisories versus closures, and there really isn't a standard rule of thumb, nor with the state or the EPA. So we're just kind of trying to get each other to be in sync, so that when this platform does go live, that it's very similar. Um, Also, as far as seasonal success and activities, the farmers market was a success this year through our ongoing inspections, permitting, and vendor guidance throughout the season. Temporary events, oversight and inspection of all these public events, including the big one of the town fireworks. We are in there to ensure health and safety compliance with safe food handling and to the public. So another summer activity is vector surveillance. So the trapping sites began, I think you remember me talking about it in June, early June. We have 2 sites that are managed by the Connecticut Agricultural Experiment Station. They did get positive mosquitoes, as we do every year. Last year, we actually had our first positive on July 1st. This year it was July 23rd, and then our second site, they had a positive mosquito pool on 7/29. Also, just to stay in line with West Nile and mosquitoes, there was the first human case of West Nile was announced this week in the state. It was actually in a Fairfield County resident. So last year in total, the state saw 12 reported human cases. So again, this isn't something that's unusual for this season. It's something that's expected. And I would just like to remind, board members and the public to still keep up with the personal precautions, especially during those peak mosquito activity hours. So tick surveillance. We hosted at the Darien Library on August 13th, Dr. Mulari. He is from the Ag Station also, and he provided an in-depth, informative talk about ticks, a public health concern, presented new trends and historical data. So that is up for viewing on the library website. Hopefully we'll have him back next year and make it an even bigger event, and maybe even offer it to neighboring towns. And we did this year receive twice as many ticks being submitted from residents in the previous year. So I'm keeping track of those trends. And it is likely due to more tick encounters by residents, and also the fact that we did a media campaign in the spring, and gave out free tick removal kits too, and promoted that free testing program that's at the Ag Station. So I can't really say if the correlation is strictly because of tick encounters, or it has to do with a little bit of highlighted publicity and promotion that we did at that time. Environmental health and permitting. We are in the middle of cosmetology renewals. So we are conducting routine inspections. We're issuing annual permits for those. We now have 40 permitted and approved cosmetology facilities in Darien. And a large project that's underway as of July 1st is the integration into OpenGov. We began building out our tile, like other departments in town, to fully integrate into that platform. This includes applications, plan reviews, all of our land use documents, inspections, a payment portal, and just that general workflow for the health department. So this is taking a tremendous amount of time for us to customize and build out this tile. And I think it's just going to be slow and steady until we can fully on board, hopefully at the end of this year. And, not only is this necessary to have us integrated, but it improves efficiency and transparency once we're in there. New establishments and plan reviews. My staff here continues to be busy with food service plan reviews and cosmetology and all of the new developments that are happening. We have several places that are in various stages of opening, building, getting ready to issue a permit to actually be in operation. And most notably is the Goddard School that opened recently. And I will just note that this is Darien's first full-time year-round early child care center program that's serving our community with watching or keeping children from 6 months to 6 years. So that's a pretty big deal. Community health initiatives that we have, the Community Health Needs Assessment in collaboration with Stanford Health has been finalized and approved by their board on August 7th. So both myself and the Human Services Director, Ali Ramstack, had been heavily involved in that process from the beginning, and that takes, years to put together. So the upcoming presentations to the community, which I would welcome and encourage all board members to attend, is October 14th. It is going to be a community forum where they're going to present the data and the report to our residents here in Town Hall from 10 to 11. There's also an opportunity in November 19th. Actually, they're going to be presenting at Ferguson Library in Stamford, and that's going to be the same day. So that will be October 14th, and that's in the evening from 6 to 7:30. So, whichever more aligns with your schedule. This data will also be presented to the Human Service Planning Council. So I have that date secured for November 19th. So I thought this is the perfect group to hear this kind of information and be able to, shift their planning around the findings there. And last thing is looking ahead into the fall, we are going to offer flu vaccine clinics. Not directly with health department staff, but we have partnered with Stop and Shop Pharmacy. And I was hearing through the senior center and through town hall staff that they really missed that. as a service for the town, and they found it very convenient to go down the hallway and get their flu vaccine, especially town hall employees. So that clinic will take place on October 16th here in Town Hall for employees. And we're actually having 2 clinics. And again, Stop and Shop comes with consent forms, registration sheets, all of the vaccine. They take away the sharps. They have the pharmacist that will administer vaccine. So basically, we're just facilitating it. We are not doing any of the billing. We're not holding vaccine. We're not disposing of sharps. So it's really a great partnership. The 2 clinics that we're going to have in the Mather Senior Center will be on September 29th and October 20th. And they will be able to offer more vaccine than we ever could. So for example, they're going to do flu, COVID, RSV, shingles, pneumonia, and Tdap. So they're able to offer all of these vaccines that frankly, we just don't have the capacity to do here.
So,
So-
Mindy,
Yep,
just
go
a
ahead.
quick thing, just to be clear. So the October 16th is an employee flu shot,
Yep,
and then
flu
the other
shot.
2 are open. The other 2 are open to the public.
Well, the other 2 really were targeting seniors, so we're trying to really
Mhm.
hone in on vulnerable group. And when I was presenting in February at the Commission on Aging, that was actually a question they had in a request. They said, we really would like to have a visiting nurse or someone come in and offer flu shots. And I thought, why don't we do that? So actually that got me thinking about the what I've been hearing from employees also about the convenience of getting a flu shot here in Town Hall.
Okay, thank you.
Yep. That's all I have.
Any questions for Mindy?
Well,
Okay.
I do have
Yeah, go ahead.
one.
Yeah.
It was earlier what you said, Mindy, about it sounded like you're trying to streamline forms and payments in the department. Now, is that kind of across other departments in town hall?
Yeah, it will be. And the building department, fire marshal, zoning, they're all fully integrated in OpenGov, and they have been. And we're set up kind of outside of that because we're using Garrison Tyler digital software. So we're still outliers of this. So what we're trying to do is just fully integrate with our payment,
Mhm.
with our so that we're not being missed in that workflow. And it's also going to be easier for issuing permits because right now our office admin is still invoicing and billing. I mean, this is going to be where somebody goes in, they have a user ID, they go in, they update their profile, they'll see that they owe, the annual fee, and it'll all be paid, and they can print their invoice or their permit right online. There'll be no
That's
more
great.
handling of those things.
Any other questions? That was great. Thank you so much, Mindy, for that overview. Because this is a special meeting, we can't take any additional agenda items. 2 things. Our next meeting is Tuesday, December 9th at 5 p.m. We will probably also do Zoom, but we can talk about if we want to get together in person. I think we still have a room reserved, so we can talk about that. And if there are any items you would like to discuss and put on the agenda for the December meeting, please let me know. So just Tuesday, December 9th at 5 p.m.
So Kevin, are you
Otherwise-
suggesting a cookie exchange?
Good idea,
Indeed.
Matt.
We have to get it approved by the health department,
Oh,
but yeah,
I'm hungry.
I heard Kevin likes chocolate chip cookies.
you're not wrong about that. You're not wrong about that. All right. Wonderful to see you all. Thank you again, Mindy, for your time and engaging with us. We appreciate very much your report, and sure I'll talk to you all before then, but at the latest Tuesday, December 9th. Thanks again.
Okay, thanks.